Today in our clinic, a patient attender had come to us to get an opinion. The patient attender told his mother, aged around 65 years, was advised surgery at some point for a MRI scan finding. He showed us the MRI. We saw the MRI and it showed hyperdensity at the level of the pituitary fossa. Then I asked the attender how is the patient and how is the vision for the patient. The patient told, vision is normal, sir. She is eating, she is walking around, she is taking care of her personal needs, she is even cutting the cloth and she is even stitching. This is what the patient told me. But MRI is showing mild hyperdensity and it was reported as a bleed in the pituitary gland. The size of the tumor was around 1.8 centimeter size with a bleed, and it was reported as pituitary apoplexy. The patient was highly diabetic. Then my suggestion for the patient was taking the age into consideration and the emaciated patient, how the patient explained. I told him, let us treat conservatively, and it was an atrophic brain in the MRI. Let us treat conservatively with medicines and with low dose steroids for around 1 week. I told him, if at all the patient has any visual disturbances, you have to approach a nearby neurological center for emergency surgery. This is what I advised the patient, and the patient also accepted for it because he has a big hospital near his home. Because of the age factor, the patient attender also was not willing for surgery, and the patient was also not willing for surgery, and they wanted a conservative means of management. Recent literature and few research articles show that you can treat with steroids initially if there is no any visual disturbance, and if any visual disturbance arises, then go in for surgery, which means that though there is a bleed, it usually shrinks in a few weeks time, and the hormone levels also will return back to normal with the use of steroids. So taking the age into consideration and the patient scenario into consideration, we suggested him conservative management with drugs, and we are awaiting for the patient to review with us after 3 to 4 weeks duration from now on. Thank you.